I'm Rick Sutterston. I'm the director of the Hallie Ford Center for Healthy Children and Families, and also on the faculty of the HDFS program. It is my pleasure today to welcome Bobbie Weber. Bobbie is actually a graduate of the HDFS program.
That's right.
And she is quite simply one of Oregon's greatest treasures. And Bobbie is an expert at all things related to child and family policy. And she is often a go-to person from the vantage point of the governor's office in particular. She's sitting on the Governor's Early Learning Council, which is composed of just about a dozen people, I think, right?
Yeah.
And Bobbie is there among them, representing us and all of our interests, and conveying research that matters and how these policy decisions are unfolding. Anyway, she is not just a state-level phenomenon. She's a force to be reckoned with nationally, too, on many of our federal child and family policy issues, and works with colleagues from all across the nation on these issues. So a warm welcome to Bobbie Weber. We're proud to be among you.
Thank you. Thank you for the. You know what I realized I don't know is, do we have a clicker or do I just click this way?
There is a clicker somewhere, but you can click that.
I'll just click this way. So Oregon is going through a huge transformation of how we look at children in the first 5 years of life, but it isn't happening alone. It's not. It's being influenced by a part of a much bigger picture of a transformation that is happening in health and education. So today what I thought, I'd start with the context because I don't think it makes sense to zero in on what we're doing with the first 5 years of life until you have some sense of what's driving all this. Why is Oregon in so much change right now? So I'm going to start with the transformation and some characteristics of it. And while we've been in the midst of it, Obama announced his plan for early education, which runs almost parallel to Oregon's transformation. So I'll talk a little bit about that. Then I'll get into, so what are we doing with early childhood? Why? What's the rationale? How are we doing it? What's the governance kind of view? And then on the ground, what actually is changing? What are we doing? And I thought we'd end with a discussion of what are the implications for those of us who work in this field, in all of these health and human service, human behavior research. So what does it mean for us? And it's fascinating that just shortly after we connected the college, I mean, it hadn't been that long ago that our college became public health and all together, was this initiative, which is amongst other things, but heavily based on linking health and education. So it was an interesting kind of parallel about what's happening. So here's the context, Oregon first. We're doing a major transformation. I don't think you can understate how big a time of change this is right now. In health, the most visible view of the change, the transformation, is coordinated care organizations, and people from health can tell you a whole lot more than I can about CCOs. But we are starting with the low-income population in Medicare, but the plan, if Governor Kitzhaber has his way, it will, within not too long, transform how all health care is delivered in the state of Oregon. So that's one. In education, there's a number of changes already in place, and then if you're paying any attention to the legislature, they've got a lot more in store for us coming through right now. But the ones that are in place, for education, we now have a chief education officer. We no longer have a superintendent of public instruction. The chief education officer gets to look at prenatal through university as his scope of work. We created the Oregon Education Investment Board. It's still yet to be determined how all the OUS and boards of education and the community college workforce development, all of that is being changed right now. But we've already created this Oregon Education Investment Board, and we created the Oregon Early Learning Council, which reports, interestingly, directly to the governor and to the OEIB. And then the changes that are proposed, a brand new governance structure for higher education, this Office of Post-Secondary Education. I don't know that anybody really knows what is going to come out of the legislative session, but we can be sure it's change. The Early Learning Division. So I'll talk more about it, but we are creating a new division that focuses just on early childhood. And then just as we regionalized with health, we're going to regionalize in early learning into something called hubs. So I want to go through some of these. What's driving it? What are the vision and goals? Why are we doing it this way? Why this transformation? What are the driving forces? So there's a number of them that seem worth looking at, and they go across health and education. The first is this adoption of these very high-level measurable goals. So for health, it's to improve the quality of care, serve more people, and spend less money. For education, it's 40-40-20. 40% of Oregonians graduate from university, 40% or a university or some post-secondary would be a more accurate way to say it. So if you could get a certificate from a community college and you could count in that first 40. The next 40 is high school diploma and no, I think I've got it backward. 40-40-20, it's everybody has a high school diploma or more, then you get 40% something, then you get 40% university. And so increasingly, all the focus is on completion. So community colleges are feeling it very heavily right now. I don't know how much we're feeling it, but they're going to start getting their money based on completions. So and for early learning, it's every child enters kindergarten ready to learn and enters first grade ready to read. These goals assume very sophisticated data systems. Health, its electronic records is one piece of it. Education, there's a student longitudinal data system. Oregon's been a leader in developing it, but it right now links down to Head Start and early intervention children and up. It's being linked to the university. The plan, you'll hear this over and over, the plan is we get you at birth and we watch you till you graduate from university. And we capture as much data on you as we can, so if you fall off the track anywhere along the way, we're going to be able to either go find you or we're going to be able to study and predict why you fell off the track. So these are the visions. These are the talk. This is the talk that you hear all over Salem. And then for early education, the plan is to develop a new longitudinal database. Starts at birth, covers health, education, and human services, captures that child from the time he or she is born and every service they get, and then links into the longitudinal data system. So all of this is because we're to be driven by outcomes, more served at less cost. Already the K-12 system and community colleges have these achievement packs in which they agree to these high-level outcomes and will be measured on them. And the plan is that early education is going to perform as contracts. Another set requires integration of systems, programs, and services. This is a major theme, integration. You'll hear over and over. In health, integration, physical, mental, and sometimes dental, and the CCOs is a good example. In education, this vertical integration to go from kindergarten through university and think of it as one system. is the plan. And so early learning, though, is not only to integrate on a vertical axis, it's also to integrate horizontally so that you pick up health and human services and early childhood, early learning kinds of activities all in one integrated system. The focus is on prevention. I'll talk a little bit later, but the plan is to screen every child at birth or prenatally if you can, and then targeting both in health and education. The idea is that you then target services to the the individuals and families who show up with risk factors. The focus is on the individual family versus programs, individual person or family versus programs. The goal that you hear over and over is we'll stop funding programs. We're only interested in funding services, and we don't care who delivers them. I don't know if any of you have ever operated programs. It's kind of mind-boggling to think, what does that mean if we're not funded, only the services we deliver? What happens with fluctuation, all those questions. Partnerships and collaborations are required. The CCOs is probably the best example of that, where communities are required to figure out how they're going to work together. As I said, they want to purchase outcomes. This one's really mind-boggling, that they only pay for outcomes. So if you don't deliver that, so go step beyond services. The plan is at some point, if you don't deliver not just the service, but the outcome, then you don't get funded. This is a little hard to imagine how any of this will be implemented, but it's important to know that is the plan. And they do plan to do this for higher ed, by the way. I mean, who knows if this scheme will stay in place long enough, but there isn't anything that they're not planning to touch this way. So regionalization, fascinating. Instead of dividing the state into regions as we have always done, the strategy with this is that the region decides their geographic boundaries. And they may not even need to be geographic. Maybe you would be the Hispanic hub, and you serve all Hispanics in the state of Oregon. For early learning, it's wide open for CCOs. I know less about CCOs, and I think so far they're all geographic. But they're really trying to just break into different ways of thinking, measuring. So those, I'm going to switch just briefly to Obama's plan. His goal, none of our children start the race of life behind. The parallels between what Oregon's doing and what's in the Obama's plan are so strong. The language, ours is no child gets to school without being ready and to be successful in school. Obama's is you don't start behind. It's basically the same. The components are almost identical. High quality preschool for every child, yet to be defined what high quality is. Opportunities before preschool, that might be all kinds of home-based services, home visiting, which is big in Oregon. That's for parents of very young children who are targeted. Evidence of quality, full-day kindergarten, and increased role for K-12. All of those are part of what's happening in Oregon, so it's interesting to see the parallels and how close they are. So now I'm going to describe the rationale for the change just for the early learning community. Before I go into this, does anybody have comments you want to make or questions about kind of that context piece? Okay. So early learning. Early childhood has been pretty invisible not just in Oregon, but in the United States. I'm not sure we're all so excited about the attention we're finally getting, because once it came, it was, but this is a big change for those of us who've worked in early childhood. We've never been seen as part of the education system. Nobody knew quite where we belonged, but we definitely were not seen as part of the education system. So that's a major change to be talking about the first 5 years of life as part of the education system. But what's driving it? All this brain research that has been published in the last 15, 20 years has had a major impact on public thinking in the United States. There is much more awareness of what happens to us in the first years of life, and that when it doesn't happen, you're not going to catch up. So that has had a strong impact, not just on leaders. The perceptions of Americans have changed in ways that I would never have said possible. When Richard Nixon vetoed our first child care bill in '71, he said he did it to save the American family. And Americans bought it. I mean, he was resonating with the views. And, you know, that's 40 years ago, but it's still a huge shift that has happened in the United States. Another driver is, as one superintendent said at a meeting I was at, a K-12 superintendent said at a meeting I was at a couple weeks ago, he said, we're spending millions trying to close the achievement gap, and we're making almost no progress. We think early childhood is there. Now, I mean, I'll just say I'm quite concerned. I don't believe in silver bullets, and I don't believe that it's going to be as easy as they think. But the thinking is here that we're going to close the achievement gap. And I don't know if everybody in this room is probably aware of the size of the achievement gap when our kids get to kindergarten. It's quite large. We're going to be able to quantify it pretty soon. But research already shows we're going to work to, I'll talk about, quantify it for Oregon kids, but research has already demonstrated a substantial gap in children who come with risk factors and children in more protected environments. And what happens at kindergarten, there's a huge gap, and they don't catch up as they move forward. Another driver is that families have a variety of needs that are integrated for them, but when they go to get services, the services are all siloed. So they have to go here for counseling or some kind of human service. They have to go here for health. They have to go here for an early education experience. They have to, anyway, and they go to all these different places, and nobody is connecting these services for them. So, and so what's driving it is this, for early childhood, this horizontal integration is to overcome the experience families are having in managing, moving through so many systems. There's the other reason is because the number of children in families who have risk factors is growing rapidly. I assume everybody's well aware that inequity is growing in the United States, but if you want to see inequity full force, look at families with young children. That's where you see these huge, huge gaps. So the majority of Oregon's children are exposed to one or more risks. So only 40% are using risk factors that are listed below, which is really interesting. Every time I use this slide, most of us can put ourselves in one of those risk factors. So that's helpful to look at. I'm one of 10 children, and you see that large family size. Anyway.
Bobbie, will you say what the 3 are? Some of us can't see.
Oh, I'm sorry. She used a different color. So 0 risk, 40%. 1 to 2 risk, 42%. 3 plus risk, 18%.
What are the risks down the bottom?
The risks include poverty, having a single mother, having a teen mother, having low parental education in the family, having non-employed parents, having residential mobility, households without an English speaker present, and a large family. So. And I don't know if you can find yourself in there, but I mean, clearly I'm in there. Most of us have postgraduate degrees, of the 10 of us. I mean, that's not a sure shot into having a risk factor doesn't mean you're in trouble. Do you know? I think that's important to point out. There are families with multiple risk factors who are doing just fine, thank you, on all the things that we care about as human beings. So it's important to know that a risk factor doesn't mean somebody's in trouble. Actually, as the head of the juvenile department used to say, there are a lot of people with no risk factors who are in trouble. So, but that is something that gets looked at a lot. We've got about 250,000 children. Can you not see any of these slides? Oh, okay. Ooh. Oh, okay. We have about 250,000 children under 5 in Oregon, and that's how they break out in age groups. It's important because what we do with kids under 3 is so much different than what we do with preschoolers that we break the ages out that way. Oregon's young children are increasingly diverse. So Jen's been helping me with these slides. We were just going through this one. So you see that the percentage of white non-Hispanic in adult Oregonians is 82%, but by the time you get down to young children, they're in early childhood, only 64%. The rest are, and Hispanic is the big group for Oregon. 24% of our young children are Hispanic, and demographers are their trends are this is going to keep going down. The number of non-Hispanic, non-whites in Oregon is going to, and in the United States, is going to continue to decrease. We're a heavily white state, as you know. I mean, compared to California, Texas, other states, but even here, it's changing. If a child is Hispanic, he's or she is living most likely in a household where the adults are not speaking English, or they're not speaking it very well. So primarily English is only in 1/4 of Hispanic households. Incomes have been plummeting. So you see the top line is for married couples. They continue to do the most, but in all, and then you have all households, the average, and then single-parent households. And you can see that the decline is true for all households with children. Incomes have been going down. So this delivery system that people are so concerned about. We have 6 state agencies deliver over 24 different programs for families in the first 5 years of life. One of the most troubling is that you can't find early childhood. It's embedded within human services. It's embedded within health. It's not pulled out so that you can see that these are services for young children, and it hasn't existed in education. So we also have had these coordinating councils that advise on some piece of early childhood, and then to make it even more complicated, for young children, the majority of both health and early education services are provided in the private sector. The pediatricians or family practitioners or the child care centers, child care providers, they are predominantly private, which has made early childhood also less visible because there hasn't been a public agency, there hasn't been a public budget that you could look at. So all of that is being looked at. We'll start the Oregon's response. It started under Governor Kulongoski when he created something called the Early Childhood Matters Council. Then in 2010, when Governor Kitzhaber was elected, he came in with this major health and education agenda already in white papers and very well defined, and hit the ground running. He knew what he wanted to do. It's interesting, he had pulled together significant opinion leaders in the United States. So this change has been very fast and very dramatic, but this is just my own personal opinion, it's happening because all those years that he was not governor, you all know he was governor, those years in between, he was developing a very clear plan on what he wanted to do, and he was building support for it long before he was elected. That's a side because that's only personal opinion, but from watching, the rest of this is pretty factual. That's just my opinion from watching. But to see how much has happened so quickly, it's probably the only thing that really makes sense. In 2011, the Oregon legislature created the Early Learning Council. It serves as the state advisory council on early childhood education that was required by the Head Start Act. It's a major component of the Birth to 20 education reform effort, and it's aligned, as is obvious by now, with health reform. In addition to creating the Early Learning Council, the legislature created and filled a position called the Director of Early Learning Service System, and it dissolved the Commission on Children and Families, which was a structure we had put in place in about 89 or 90, and it is now going away. It was county-based. It increased funding of early learning services pretty substantially. Those are things that happened in the last two legislative sessions. The ones now that some initiatives that have come out of the Early Learning Council, a plan to screen every child at birth has been developed. A set of screening tools have been adopted. Now the Early Learning Council and the Health Policy Advisory Council are working together to get it down. The goal was to have pediatricians and early childhood staff in all kinds of facilities use the same screening instrument. I think they may end up having to do two. The doctors don't want to give up the form they're used to using and comfortable with, and it's not an appropriate form for anybody outside the medical field to use. So I think there'll be two. There's a plan for an integrated early childhood data system, which links to the longitudinal data, the student longitudinal data system, but it's only a plan, and I don't think anybody at the policy level has a very clear understanding of what that means, what it will take to bring human service, health, and education data into an integrated child-level data system in which you can look in there and see any child and what their services. Anyway, there's the planning has started. The design, the early learning hubs, there's a report out, a set of recommendations on the design of them, and there was the submission of a comprehensive children's budget, and the concept behind that is since the money that we spend on the first 5 years of life is in all these budgets all over state government, let's look at them Now, this isn't moving them. This is just look at them through one lens. So we did that. We have a comprehensive children's budget. Some other kindergarten readiness. Have people heard about this? Well, students have been working on it, so I would think you have, many of you. So Oregon was a leader back in '97 when it created a kindergarten readiness assessment, but it wasn't done with rigor. It was voluntary. Teachers weren't trained. It was subjective. So it wasn't worth the findings. You couldn't rely on them. There was no validity. There was no reliability. So it was disbanded, and the commitment was to create a new one, and the legislature required the Early Learning Council to work with the Department of Ed to do so, and to do it in a way that we would field test it last fall and would implement it statewide. And we worked under unbelievable deadlines, but we did it. And if you don't know, Megan McClellan worked with Jane Squire from University of Oregon and many, students in this room participated in doing a review of all the appropriate instruments, which ones would predict to third grade reading. And so a composite instrument was field tested in the fall, and it is the planning is now underway for how they're going to teach kindergarten teachers all over the state, and it will be implemented in the fall. So that question, if you think back, all kids will enter kindergarten ready to learn. This is the method by which we are planning to be able to do that, is the analysis of data coming from that. The development and implementation of a tiered quality rating and improvement system. Does that resonate? People know TQRS? We've been working on a system of trying to document how, the question is, how good are these arrangements that young children are spending their time in? What's the quality? And we've been experimenting for a number of years. Michaela's been working on a project. This, though, is new. It's being field tested right now, and we received the state received a Race to the Top Early Learning Challenge grant to be able to implement it, and the goal is to at someday rate every single program, every single regulated program in the state of Oregon according to these sets of standards. And as just a connection to OSU, Shannon Lipscomb from Cascade Campus and I are working with PSU. We've designed the validation study and probably will be implementing it. And the validation study is, so we came up with these standards. Do they really differentiate the quality by external measures of quality? So, and then the process we'll go through is whatever we learn from that first study, we will revise our standards, probably make fewer standards and more targeted standards, and then there'll be a second study, and the plan is to see if children do better in highly rated programs than they do in less highly rated programs, as a validation of, do our standards actually differentiate? So the legislative proposals right now in the legislature are to create this division of early learning in the Department of Education, to bring most of the early childhood programs, as many as they can, into this new division, to expand Healthy Start, to children birth to 3. Now it's first births. Now they want to look at all children under 3. Align health and early learning systems, more of this integration between health and early education, early childhood, to develop these hubs. There's one bill that says we're going to roll it out across the state. There's another bill that says we're going to do demonstration projects. So yet to be decided, and to further increase funding for early learning services. Here are a couple issues that are likely to receive a lot more attention in the next year or so. You can hear the rumblings now. The first is where young children are and what does that mean, and the role of the philanthropic community, and they're related. But interestingly, maybe people in this room know, but when you ask, where do you think children under 5 spend their days? Got any thoughts? It does vary some by community. That's true. But where do you think the majority of them are?
A lot spend time in daycare.
Child care?
Family-based care. Family-based care.
Family-based care. So let's look. I'll show you where Oregon's kids are. It really varies. Can you see back there? Okay. It varies by kids under 3 and children. By the time they're 3 and 4, families are doing quite different things. So only 18% of children under 3 are in these formal arrangements, a child care center or a child care home. Instead, a whole lot of them are with grandma and other relatives and friends, neighbors. And interestingly, parents report using no non-parental care in large numbers. 44% for the youngest kids and 40% for children ages 3 and 4. And they're answering a question, do you have any non-parental care for paid or unpaid for more than 5 hours a week, I think is how we ask it. Interestingly, these numbers surprise people, but I'm part of the consultant to the National Survey for Early Care and Education, and we're not different. So this idea that most of our children are in child care centers, it's just not what families are really doing. And if you go back to that slide about household income, if I had put what child care costs there, you would have seen why they can't possibly be huge numbers of them. You put household income next to the cost of child care, and it's not an option for a huge percentage of Oregon's families. So related to that is that few of the dollars that we spend are really targeted to services, early learning services outside of the formal settings. And so but we have found a variety of services to be helpful. But if your goal, the reason I'm sure this is going to get increasing attention is, if your goal is that all children are going to get to school ready to learn, and what that really means is they have the set of self-regulation, social emotional skills, and some of the basics about numeracy and literacy. So if they're going to have those skills, then, and we know that they don't now, we certainly need to be looking at more than the formal settings. Does that make sense? So that's why I'm convinced that this is going to get increasing attention. So the kinds of things that have been found to be effective in reaching children who are in home-based settings to support learning and development, there's a number, but parent education is a big one. Home visiting that we talked about, and home visiting that can be expanded not just to the parents of the child, but to the caregivers, those grandmothers and other neighbors, friends who are caring for children. And the idea, and what these strategies usually do, is get literacy, language, numeracy kinds of activities into these settings. So, and one of the ways they do it are things called play and learn groups. It goes by different names. Seattle has a huge 38 organizations work together, and they just offer these enriched settings in libraries or all over the city, and anybody who's home with children can come and spend a morning. And they register, and usually these programs will have a block of time where the adults are talking to each other and getting ideas about supporting development, and the children are in supported early learning. So I'm thinking, my own crystal ball says, we've got this goal and we've got this reality of where the children are. And these two pieces are going to come together in the next few years, because we, as people become more aware of what's really going on. Another issue is that the philanthropic community right now is the major funder of parent education in Oregon. We put very little public money, and what we do is comes and goes. So the ELC has said over and over again how committed we are to a public-private partnership, and we have one of those major funders of parent education sitting on the ELC, and I expect in the next few years to see something coming in the line of a public partnership with these philanthropic providers of the current funding. I mean, these are all just opinions, but given what I see and hear, I think that's highly likely. So I thought, I don't know, we've got 15 minutes. I thought it'd be fun to see what you think this means if you're going to work in Oregon in either health or education, or what you think it might mean for our college. I mean, I'm wide open to whatever, but I was hoping that there'd be a conversation about what, or, you know, feel free to ask me. I went through an awful lot very quickly. If there were things that you said, I really don't know what you meant, I'm really happy to go backward, too. So
let's go with the question. And actually, why don't you state your name as well, just so we can get to know each other, a lot of new faces today.
Hi.
Hi, I'm Dave Rabinowitz. I'm just a community member.
Uh-huh.
But I have a couple of concerns
Okay.
with what you described.
Okay.
First is the obvious concern of the concept of Big Nanny is watching you from cradle to grave, which, but even more important than that,
Right.
I think two generations ago, whole language was introduced to teach reading. And it literally crippled a generation of children who actually went to schools that adopted that. Millions of people who are today unable to learn new words in reading. For the past decade, I think people are beginning to realize that millions of children have been crippled by No Child Left Behind. People are realizing this. I'm afraid that depending on how this is implemented, this is going to be just more of the same.
I'm sure you're not alone in your concerns.
As soon as you
That-
talk about outcome, rewards for outcome, you're talking about teaching to the test. That's pretty much guaranteed. So that's one of the crippling features of No Child Left Behind, by no means the most important one. But if you look at really young children, the thing they like most, more than candy, cake, ice cream, or anything, is learning something new. You ever see a toddler learn something new? They're running around showing everybody. They're just overjoyed. And if we wanted to put together a process to teach children to hate learning, I don't think we could do better than what we've got now in the education system. And I'm afraid that until educators publicly announce that and accept it and start looking from scratch, things are just going to continue the way they are. or get worse. Those are my concerns.
I'm Megan McDonald in the Exercise and Sports Science program, and I have a question in regards to the screening that you were talking about from 0 to 5. So it sounds like the school readiness is that's the outcome measure. Is that the outcome?
Well, school readiness is the over. The screening, though, that they're recommending is the ASQ.
So in terms of having two different screening measures, what exactly are you looking at? Are you looking at some of the risk factors that you discussed in terms of that were on one of the PowerPoints? Or
No.
What is the...
That's a huge disconnect, is that you look at the risk factors that the state talks about or that were on that screen, and you look at what we're screening for, and they don't go together. But there wasn't the committee that they have a report. If you're interested in it, I'd send it to you. That the screening committee, there was not an instrument to measure most of the things they wanted to look at, like the household income. There just wasn't a good tool, or the family kinds of dynamic characteristics. There wasn't a good tool, so they ended up recommending the ASQ for the general, and I think PEDS is the one that the doctors are. I know it's the one the doctors want.
For the early learning screen?
This is for the 0 through 5 population, to start at birth, to screen, and then to continuously screen as the child grows. And there's this disconnect between what we've defined as risk factors and what we're screening for.
Can you talk a little bit about what on the ASQ, some of the categories on the ASQ that are...
Oh, golly, if I look at... this is... It's heavily developmental. It's used when it's designed for parents to complete, actually, not professionals. And if you do it online, then and the child shows up as behind some marker, the computer will actually send a referral to early intervention, is the way it's working right now. And so it's heavily development. But the items, I'm just running a blank on what the items are, but it's development. It's clearly development, that's why there's this huge disconnect. This is stuff that's happening so fast. I don't know if there's lots of issues. I'm not highlighting the issues, but your questions will pull them out. There's one.
Well, your point before, in a way, was that some of those very crude metrics we use as measures of risk don't serve well as proxies for the things we really care about, right? But
that's right.
That our policies often rely on these kind of binary statuses. Either you are or aren't in these
right.
groups, and then you might cluster them together to have a risk score, but it doesn't really tap into the things we most need to know.
Right.
Go ahead, Patty.
I'm Patty. I work at the High Force Center. So you have the screen, the pie charts with the different percentage of risk factors, and you mentioned that some families have multiple risk factors but are still doing well. The kids are doing well. Are there studies on those families and why they're doing well, and that's being incorporated into?
Well, this college has research that gives us clues as to why that's true. I mean, resilience factors, and but I don't think there's an easy answer to that. If there were, we would probably be acting on it, but it's not so easy.
There is that those are on both sides. So they're those who on the surface should do well that aren't, and then you mentioned that
right.
as well,
right.
and the opposite, right? They're off diagonal. We often care about the diagonal more than we do but the off diagonals offer really important insights into the kinds of processes that we also care about studying.
Right.
And that's your point.
Right. Absolutely. We need, that's.
And so that it's not that there's always a deterministic relationship between one's background and resources and the outcomes.
Right. There's not. No.
It's somewhat related in the sense of there was that tiered evaluation system.
Tiered quality rating and improvement system.
So the results from that would say good program, bad program?
Tiers. There'll be every licensed child care and education program will be in the system, but you voluntarily go up to 2, 3, 4, or 5.
And then, would you say that those then would inform what makes a good program? Or, I mean, because it's like, then what are they doing that makes it?
Well, there we do have like 40 years of research on the characteristics of learning and development programs that are associated with positive child outcomes. And the trouble is to try and get the standards just right so they actually predict to those outcomes. It's one thing to do a research project. It's another to implement something statewide. I assume we don't have it quite right yet. I mean, that's what the validation study is all about, is, that I assume we won't get it right the first time. But we're designing it to keep changing it. I mean, to study it and then keep changing it.
Go ahead.
Could you, this is a question kind of related to the evolution of policy. So if you think about policies, and part of my question is, I'm thinking about language right now, language issues and policies. To whom is that language directed? Because this is a system about children who live in families.
Mm-hmm.
So just some inconsistencies that make me have that question. The materials talked about funding outcomes,
Mm-hmm.
and your materials talked about being focused highly on children and families. So, but we're really talking about outcomes. I didn't hear how the outcomes really connected to children and families. And the focus is on outcomes, not services or programs, but Healthy Start is mentioned by name, not a particular service, but Healthy Start. And other programs that I care about, like Readiness or Pre-K, not listed. So, do you have some thoughts about that inconsistency?
Oh, well,
and language?
Healthy Start, I'm not sure which slide. I mean, the Oregon Head Start pre-kindergarten is still getting increases in budget.
Well, what you showed here talked about we're highly focused on children and families, but what we're really interested in are...
There's one thing. I tried to make clear that there is this language that is shaping both health and education reform, university all the way down. That's where the language for services versus program is coming from. They're trying to apply it to higher ed. The funding formulas for the community colleges are being totally reshaped. So they're going to, the proposal is they're going to get their money on how many students complete, not how many classes they teach, not how many people who take the classes. And the goal, so what I was describing there is the language being used in policy for this whole transformation. In actual, on the practice, on the ground, what are we doing? We're funding programs.
Well, I was kind of thinking
that's what we're doing.
From the perspective of policy, is policy written for those groups that are going to do the stuff, or is the language written, I mean, it feels heavily directed that way. So I think when families hear about these things, they don't know what's being talked about. So in your sense, is policy really focused more on a certain group of people and it's not necessarily all inclusive?
Well, I think we got apples and oranges going there, but I don't have any idea how many families in Oregon are following this policy conversation. They don't understand the services that are available to them right now. If you stop a parent, when you interview parents about what's available, they don't know most things are available to them. So that seems, I mean,
Problematic, I guess, just
oh, sure, it's problematic. Yeah, and the lack of engagement of families in these policy discussions is also problematic. I mean, most of these discussions have no or token levels of family members participating. I think all that's problematic. Yeah.
So the proposed longitudinal data system, is it known what level of detail, what kinds of outcomes are going to be tracked?
No. It's the plan. I was on a committee that came up with a plan, and it was to start really small and just work on home visiting. But home visiting across Head Start, any place it happens, Head Start, the health-focused home visiting, the Healthy Start, anyway, a broad array that are working together. And our statement was, well, they get families really young, so why don't we start there and then start building out? But the state has taken on data as a major initiative, and so really everything has been pulled back, and out of the governor's office they're looking at what they need to do, but it's in its infancy is my own personal opinion. So I'm not too worried about Big Brother yet, because we don't have a clue how to do this yet.
The scope is the plan scope is everybody, all children?
Yes, it is. To start at birth and to assign you an ID number that stays with you till you get through university. Yes, that part is, yes. Now, whether it'll happen, but that is the plan.
It seems like if there's already a program in place for the school readiness that's being implemented the fall 2013. Right?
Yes.
That's going statewide. It seems like that would be a natural starting place because it's already happening with that 5-year-old or that group that's just entering school. So it seems like that would be pretty.
Well, we do track them from the minute they enter kindergarten up through, and I don't know how far the linkage is to university. We do track from then on.
I mean the 0 to 5.
The 0 to 5.
0 to 5, and then looking at their outcomes on the school readiness.
Yes, that, and there's nobody's brought this up, but there's a lot of concern that we're saying you walk into the door and we say your child isn't ready. The kindergarten readiness really needs to be renamed. It's what you're talking about. The idea is that you get it and you can say, well, how well have we done? How well have we, families, health, early learning programs, how well have we as a community supported our children? That's the design. The purpose of kindergarten readiness is to give us a tangible measure of how well we support our children and families.
One more. Oh.
If you're speaking about health and education, I think one option that could probably very inexpensively make massive improvements in a lot of children's learning is just providing an optional free breakfast for every student in the school. Has anybody talked about that?
Yes, but as we said, the most young kids aren't in a school or any place. So once they get to school, yeah. No, breakfasts have become a pretty common part of schools. Yeah.
A free breakfast?
On the sliding fee scale, or the free and reduced lunch.
Okay, thank you. We've exceeded 1 o'clock, but I do appreciate it. Thank you, Bobbie, and thanks to all of you for coming.
Yes, thank you.
Have a great weekend.